Hi everyone, I'm Erin Jackson and I am a speech language pathologist at Therapy Care. Today I am talking about hearing loss and its impact on speech and language development. I think this is important to talk about because in my experience this isn't always obvious to parents that their child may be experiencing a hearing loss. So I want to spread awareness of some of the effects that even a mild hearing loss can have on a child's speech and language. So children can experience hearing loss at different times in their life for a variety of reasons. Today I'll be focusing mostly on temporary hearing loss in childhood. I would say most children go through periods of temporary hearing loss. This can be caused by ear infections, sinus infections, or sometimes just having a cold. Also, having large amounts of earwax or impacted earwax all can have an effect on hearing. Most children get colds here and there, but when they have constant reoccurring colds or ear infections, this is when the hearing loss they experience during these conditions can become a problem and begin impacting their speech and language development. You know, when you have a cold and your nose is really congested and you can just feel that pressure in your whole head, sometimes it impacts your hearing where it sounds kind of like you're underwater and everything sounds kind of muffled. And as an adult, it's annoying enough dealing with this, but you may not realize how profound of an impact this can have on a child. Young children depend on hearing speech and words and sounds to develop their own vocabulary and understand how speech sounds are made and formed. And if they aren't hearing a good, clear model of these things, they will not learn how to accurately say certain speech sounds or words. Like when a child has a middle ear infection, this means that there's actually fluid present inside of their middle ear, and obviously this will have an impact on their hearing. A common thing that is seen in children with hearing loss is they leave off or omit certain sounds of words or parts of words. So for example, they might say how when referring to a house and leave off that S sound because that's what it sounds like to them. When others say house, they aren't hearing that end sound. Also, there is a direct link between how many words a child hears and their vocabulary size. So if a child is not hearing all of the auditory input in their environment, this can have a big impact on their vocabulary development, as well as many other areas of language development, like their ability to answer questions or follow directions or forming sentences. So when a child is referred to a speech therapist, one of the first questions we ask the parents is, has their hearing been tested recently? And this is because hearing is such a critical piece of speech and language development, and if there is even a slight hearing loss, it can really have a domino effect on so many different areas of their development. So if you have even the smallest concern that your child might have a hearing impairment, get their hearing tested or address the cause of the hearing loss as soon as possible, which could mean something like getting tubes placed in their ears due to recurrent ear infections. Time is really critical when they are so young. They develop at such a rapid rate, and even a few weeks of experiencing hearing loss can really impact them. If you also know that your child is not meeting speech and language milestones for their age, make sure to see a speech pathologist who can help them catch up to their peers in those areas. I do offer free speech and language screenings, so if you are unsure if your child needs an evaluation, you can email me at ejackson@therapycare.com and I can help you decide the best route to take and answer any questions you may have. So I hope this information is helpful. Thank you all for listening.